the fabulous, the fierce, the beautiful Dr. Serena H. Chen from Northern New Jersey, IRMS. How are you?
Hi, Alice. It's so nice to see you.
It's so nice to see you too. It's been a bit of time because now we're doing this every other week thing with you.
Yes.
We give others
Yes.
some visibility. So I do miss you, and I love the color of your glasses today. You kind of match my
Kind
sweater.
of match, yeah, a little bit, yeah. We have beautiful weather in New Jersey today, so we're really, knock on wood, we're lucky. So.
Well, let's get you all warmed up. We have a question that's already coming in from Heather. She's on her 4th IUI and switching from letrozole to Clomid. Will that help us at all?
So definitely, if you've been doing plain IUI without any medications at all, and your tubes are open and the sperm looks good, then we definitely think Clomid or letrozole added to IUI will be helpful. If you have PCOS, I would have a preference for letrozole because there's some recent data showing that letrozole might yield higher pregnancy rates in patients with PCOS. If you have more unexplained infertility, then letrozole or Clomid seem to be very similar.
What is the theory behind the reason for that, of why letrozole is showing potentially better results than Clomid for PCOS?
I don't know if there's really a theory, because both letrozole and Clomid induce ovulation, so it's not clear. And the end pathway is, even though they go by different mechanisms, both of them raise FSH to LH ratios, and act like letrozole lowers estrogen, and Clomid just makes your brain think your estrogen is lower. So there are similar types of pathways. So it's not clear to me what the mechanism is, and beyond just inducing ovulation.
Okay. Does letrozole have a similar side effect as Clomid with the thinning of the lining of the uterus?
I think it does, although some people claim that it's not as bad as with Clomid, and perhaps the metabolites that stick around afterwards are different, because Clomid is known to have these metabolites that hang out for like a couple cycles, not just short term. And maybe that's different with letrozole, and maybe that's the reason. But this data is purely just based on pregnancy rates, just like numbers. We have a lot of people who did letrozole, a lot of people did Clomid, and the statistics are there. So we don't understand the reasons why so much, but we do have strong data.
Okay, that's great. And just to remind you guys, Serena's phenomenal with data. So if there's a study that's been conducted out there that you need to know about, she probably has read it. And if you have a question like the one that I just asked about the mechanism behind it, she tells the truth. Yes. All right. Fitness Fertility is asking, do you know different types of exercises that could affect endometriosis?
So I think in general, endometriosis it's one of the most common forms of infertility. March is Endometriosis Awareness Month. It is a very common cause for painful periods, painful sex, and it can take many forms. It can be very mild, or it can be very severe, where it can actually cause things like bowel obstruction and things like that. It appears to have something to do with the immune system, and it does appear to be an inflammatory condition. And a lot of the symptoms are related to the level of inflammation. And exercise, we know, is anti-inflammatory. And there are studies demonstrating that rigorous, regular exercise seems to reduce endometriosis pain. I don't know if there's like similar studies looking at fertility, because that's much harder to do, exercise and fertility, because a lot of endometriosis patients use many other modalities like surgery, IUI, IVF to also get pregnant. So to measure just the effect of exercise alone is very difficult. Whereas where you're looking at just one symptom like pain, that's like a much easier study to do. So we definitely have evidence that endometriosis pain is improved with regular exercise. And we know that exercise in general is anti-inflammatory, and an anti-inflammatory lifestyle seems to improve endometriosis pain. And we're kind of extrapolating to say, well, if we're improving the symptoms of endometriosis, it seems to follow that we would also improve implantation rates and pregnancy
Makes
rates
sense.
as well. But for pregnancy,
Mhm.
it's a little bit less clear. So it's not a specific type of exercise. I feel like you need to get your heart rate up. You need to do a balance. All people that are, everybody should be doing a balance of cardio, strength, flexibility, and balance. I feel like there's a bias. Women seem to have a bias towards cardio because a lot of people are concentrating on losing weight. But the truth is, building up your muscle
Strength training. Yes.
raises your metabolism, and that
Yes.
ultimately burns calories all day long, as opposed to cardio, which only burns extra calories while you're doing it.
Yeah. And it doesn't have to be weight as in like weights. I mean, I've got dumbbells here and I've got kettlebells just in my
Yeah,
office.
you don't have to
It
do
can be
that
body
now.
weight. It can be
Body
body
weight.
weight. And with YouTube and probably TikTok, there's so many. I saw this yoga instructor doing some great pre-bed rituals that I'm now incorporating at night. It was just like 4 little stretches that I loved. And so I've been doing that as part of my nighttime routine. So there's so many good resources out there. And I don't want anyone to get tripped up by that word rigorous, because we just have to get moving, you know?
You have to get moving, exactly.
And I think, and the catch-22 with endometriosis is that if you're still in throes of such severe pain that you can't even get out of bed, don't beat yourself up for not getting there yet. Deal with the pain first so that you can get to a level in which you can just cope with normal everyday life, let alone beyond. Just know that if you need pain management that are in other ways, that then you can start an exercise program and taper off the pain management to see kind of what your plateau levels are and what is kind of perfect for you. I just want to say a big shout out to Renegade from Endo Glass for putting on her first and the most incredible weekend. She did a whole entire symposium. The first, she called it Our Table Conference for women of color, allies who are dealing with endometriosis. I joined for a couple of sessions on Friday. Unfortunately, I had to miss some sessions on Saturday, but she did a phenomenal job moderating, having really incredible stories. Tia Mowry shared her story. She has a couple of anti-inflammatory books that she's written because of what she's dealt with endometriosis. And now she has had a surgery, but with her lifestyle changes, she lives pain-free.
So that is like such a great example. Endometriosis is a multi-pronged approach. That's the best approach. So, diet is not going to cure everything, but an anti-inflammatory diet definitely helps with all these other things. So she is a perfect example of that. Surgery, anti-inflammatory diet, add a little exercise, make sure you're getting good sleep. That's another big deal. Right. So, we want to create the whole person.
Yeah, exactly. Okay, super helpful. Heather McDonald was asking, she also has been using letrozole and a trigger shot the past 3 times, but now they're switching to Clomid and a trigger this cycle. She does have PCOS, same-sex couple, and that's the only reason for doing treatment. Do you mean the only reason for doing treatment is because you're a same-sex couple, or because you realized before embarking on your fertility journey that you have PCOS and knew to not try maybe IUI alone? I'm just curious about that's the only reason, because there was 2 reasons. PCOS is definitely a reason, and being a same-sex couple, second reason. So I'd love some clarification, but it's interesting that we have somebody in the audience who's kind of talking about that very thing when you have PCOS patients. What's your determining factor when someone presents with PCOS and deciding, do you try letrozole first, or do you try Clomid first? How do you decide?
The letrozole studies are very new and it's very in, and honestly, I'm not convinced that it's that much better, because there's a few studies, the data is very impressive, but Clomid's been around since like the 1940s, so, and a very reliable drug. And like 80% of people ovulate on Clomid, 60% of people get pregnant. So it's definitely it's just nice to have more than one tool in the toolbox. And it's nice
of course.
letrozole and Clomid. And if you have side effects on one, then certainly you switch to the other, or if you've done a few cycles with one, certainly, and you're not ready for IVF, because after like 3 to 6 cycles, usually we're moving to IVF. We're recommending that.
Sure.
But for same-sex couples, like in New Jersey, they have to actually do many months of IUI before they can get their IVF benefits if they have them. So there's many reasons to vary, and I think it's just good to have more than one choice.
Yes, of course. Does maybe history of breast cancer in the family play a role at all? Would you?
It's interesting because letrozole is obviously used in some breast cancers, but Clomid is actually related to tamoxifen. It's a selective estrogen receptor modulator. So,
I didn't know that. I love it when I come on these things and I learn something brand new, you guys. That's awesome. I did not know. I was on tamoxifen for 3 years.
Estrogen receptor modulators, and Clomid is one of the oldest. It's the first selective estrogen receptor modulator. And, sometimes we will use tamoxifen for ovulation induction as well.
Yeah, you just, tools in your toolkit. Kels, I hope that Kels is still on, because this is a really important question. And I was just talking to Serena about it before we hopped on, which is that the misinformation about COVID vaccine causing infertility. So, she has read many COVID vaccines while trying to conceive. Somebody told her to wait to get it because there isn't enough data yet around how it can affect fertility.
Oh my gosh. So there's, Alice, I guess you could put a link up to that wonderful paper that was just published in Fertility and Sterility about how this is just fake news, essentially.
Fake news.
COVID vaccine and both male and female infertility is completely fake news. It is strongly advocated by the American Society of Reproductive Medicine, ASRM, and SMRU, the Society for Male Reproductive Urology, saying that it is all 3 vaccines perfectly safe to use while you're trying to conceive. And there was this crazy article that was taken down after a huge outcry about how it made no sense by 2 people who theoretically have kind of a scientific background, like a former Pfizer scientist and another pulmonologist, claiming that the messenger RNA sequence in the Pfizer and the Moderna vaccines was similar to a placental protein, and therefore could be thought to cause miscarriages and infertility. And the truth is, like, it doesn't have homology.
Does not have that at all.
Yeah. So it was like it was kind of just made up and very harmful, because if you are preventing people from getting a vaccine during a pandemic, you are putting them at risk for getting COVID, and we know COVID can be deadly, and
especially for pregnant people. Not just deadly to you, but to the child you have worked so hard to get pregnant with.
Pregnancy is officially a high risk category by the CDC. So
and a lot of our users are already high risk for severe COVID because they have PCOS. Or endometriosis or obesity. And then on top of that, if they successfully conceive, now they have something else that puts them at high risk for severe COVID.
Misinformation and anxiety. So I really want everybody to know, and we'll put the article up again.
Yes. And the other positive thing to remember is that those who have successfully gotten the vaccine, the first baby born with antibodies.
Yes. That's
so
true.
Healthy baby that was born with COVID antibodies. That's exactly what we were predicting. That outcome is happening. And all we want is for our community to have healthy babies, and we want the mamas to be healthy when they have the babies. So that's all we want.
So that's
so cool. And we have so cool. And we have to keep letting you guys, keep telling your friends to come on and hear these talks where we talk about the vaccine. My second dose is on Wednesday. I'm doing an embryo transfer in late May.
Awesome.
So for me, the timing just worked out that I have a couple of months after, but I would have I would have scheduled it. So just even 2 weeks after, I would still do my transfer. It's just worked out when I could get into the state where I'm doing my transfer, because I have to travel from Idaho down to Southern California.
The latest guidelines from ASRM says, just avoid doing your transfer within 3 days of the vaccine, just because
you feel crummy. Your immune system's like operating on all cylinders, like making all your spike proteins and all those good little antibodies you have to visualize. But I mean, most people have enough side effects. You don't want to run into your embryo transfer, I feel like, fast.
It's just like you want to kind of have a light day about 24, 48 hours after your second dose. It's
exactly.
Have a light day.
Yeah. So I scheduled myself off, if you can believe that. I'm planning to have a movie day on the couch with Dante.
Perfect.
Yes, I know, which I never schedule myself off, you guys, just in case you didn't know.
Although I don't know that a day with Dante is a light day.
Well, he's such a trooper. So if he knows that I don't feel good,
he's gonna take care of you.
I wouldn't say he'd go that far unless he's gonna like heat up a pizza Lunchable, which doesn't sound appetizing even on the best day. So I don't think he's gonna heat me up some soup. Yeah. Oh. Actually, he did something this morning that was so thoughtful, and I said to him, "Gosh, you're getting so thoughtful in your maturity." These little moments when they're 7.5, you guys. And if you don't know my first story, he was a frozen day 2 embryo for 5 years before I did my transfer with him. I made him 14 years ago, but he's only 7.5.
Yeah, that's kind of cool, right?
That's science math.
Maybe that's why he's wise beyond his years.
It must be. He always says that. He's like, really, wouldn't I be 14? Yes, pretty much. All right. So cervical stenosis. Nikki's asking about cervical stenosis. She recently had a failed HSG done by a radiologist, though.
So you might not have cervical stenosis, because half the cases of, or more than half the cases of cervical stenosis diagnosed by a radiologist is really just doctor can't get in the cervix.
Yeah.
So because radiologists are not trained to deal with
what they do all day long. That's just not what they do all day. Go to see a fertility specialist and let them do it.
Yeah.
Yeah. She said, oh, and it's very tunnely. That's what her radiologist said. When we hear things like this, we're like, I can just go to a specialist and let somebody who does it all day do one.
No, probably not. I just, you need like somebody who deals with with the vagina all day long.
Yes, exactly. So Nikki, like, you didn't have a failed HSG. You had a failed radiology attempt at doing an HSG. And so nothing, don't assume anything's wrong. And I was told once that I had cervical stenosis, and then I went to a seasoned fertility specialist, and he said, I don't know what your other doctor was talking about. There's no problem getting in here.
We see that all the time, because radiology, they, most of the day they're looking at radiographs, pictures and things like that. That's their area of expertise. And we would look at these things and be like, oh, everything looks gray. But, it's just a different area of specialty. And I think most of the time, your gynecologist or your fertility specialist will not have an issue.
Exactly. And if you need help finding someone that you can get in just for an HSG, just let me know, and I'll reach out to my team to help you find somebody in your area. Some folks, look, half the market lives more than 100 miles away from a fertility clinic. So in those cases, we got to reach into your community. We need to help you find somebody who routinely does them. There are plenty of OBGYNs who will do them right in their office. Yeah. It's just you, like Serena said, you want somebody dealing with vaginas all day, every day. That's who you want to be putting the tiny tube up and blowing up the balloon for an HSG and inserting the dye so that they can see in your tubes. So hang in there, Nikki, and let me know if we can help you. Life and Style Grace is asking, and she's actually asking something that we get asked quite a bit on these shows, Serena, about immunological issues related to losses. Yeah. She did do, and this kind of growing, the immune protocol idea is kind of growing in popularity with like specific clinics who say that they're just immunological fertility specialists. I don't know much about those clinics yet, but I'm starting to see them pop up. And she was working under what I believe she meant to say was an REI. So what are some of the immunological issues that might arise and might be the cause of recurrent pregnancy loss? Let's start there.
So the most common thing is antiphospholipid syndrome, which is actually not so common. But anybody with recurrent pregnancy loss, that's 2 losses in a row where you get to the point where you actually see the sac and then lose the pregnancy. The recommendations are to do a full evaluation. So to do karyotypes, to evaluate the uterus, to karyotypes on both the male and the female to look for balanced translocation, check thyroid function, anemia, diabetes, like general health type stuff, and then check for antiphospholipid syndrome, which is to do a panel including lupus anticoagulant, anticardiolipin antibodies, and beta 2 glycoprotein. Now, there are some people who are very active on the internet that are doing a huge panel, including NK testing, natural killer cell testing, and things like that. And those tests and treating those tests has not really been validated in the scientific literature. People have looked at this and studied it a lot, but have not really been able to see that the testing has any benefit or treatment of that testing has any benefit. And there are definitely risks to those kinds of treatments. So, there may be some people who might benefit, but right now, ACOG and ASRM are saying there's not enough data to support even doing that testing right now.
Right.
So,
yeah, this is why it keeps popping up, because it's popular.
Well, a lot of it pops up because, in mice, you can identify these syndromes where, like the immune system is involved, but it seems like humans are a lot more complicated. And
we're not mice. We are not mice. We are not tiny little mice. Yeah, we got a lot more going on.
It's hard to get behind that stuff because there's really not enough data, and there is significant risk. Now, for things like CoQ10, taking CoQ10 to improve your ovarian response, there's not enough data to say, okay, this should be standard in everybody, but also there's not
there's not downside
because CoQ10 is a natural factor that we make anyway, and supplementing it does not seem to cause any harm.
Right.
So that's a very different story, that type of treatment.
Yeah, exactly.
Where the immune treatments have potentially serious health consequences.
Right.
So
right. This is a tough one. We probably should do an entire show on this. I'm thinking and promote it properly, because it keeps coming up. It's it's controversial enough, and we have a number of patients that are kind of seeking, those immunological answers. It's almost as much as the one cycle of IVF. So we just want to make sure that proper informed consent is something I'm very passionate about, that we lack in a lot of areas of healthcare. This would be one of them. We just want to make sure that you kind of have all the facts. And you can always book second opinion consults with IVF doctors in your area to talk about it, in like a local market, or book a second opinion consult with someone on our app too. I love Jess. Jess is asking a really good question. She is, she takes a small dose of Synthroid for her underactive thyroid. And she was thinking about adding a hormone balance supplement kind of in her IVF prep routine. So she is headed for IVF. So a few pieces of data. We know she's taking Synthroid, underactive thyroid, which, by the way, Jess, there's like so many of us who have the same thing. I mean, I feel like it's one of the most common thing for reproductive age women, that we all seem to need a little thyroid support. And she did not mention which hormone balance supplement she's referring to. I don't know if she's referring to maybe Ovasitol, which would be a hormone balancing supplement. And if that's the one, could you let us know, Jess? So she is kind of seeking advice though in general about an IVF prep routine. So let's say that somebody's a month away or 2 months away, like in my case, from doing an IVF, either egg retrieval or frozen embryo transfer. We know clean eating, upping vegetables, getting the activity going, but what else do you like to recommend for patients in that prep routine so that they can kind of get themselves ready?
For usually I feel like if people are people often have enough to do with all the healthy lifestyle stuff. So I don't standardly put people on anything more than a prenatal vitamin with DHA, some omegas, either fish oil or flaxseed oil, or if they have a really good diet that includes a lot of omegas, like 8 to 12 ounces of fresh seafood a week, and extra vitamin D3, because I'm in New Jersey and everybody in New Jersey needs at least 2,000 extra units a day of D3. Like if you're in Florida, you probably need less.
Right.
But in New Jersey, the prenatal vitamin is not enough. So those are the routine supplements that I give to everybody. Ovasitol I will do for PCOS patients, people with a history of insulin resistance, borderline elevated glucose levels, things like that. And then beyond that, if people are interested in, like, have a history of decreased ovarian reserve, then we can think about things like CoQ10 and DHEA and melatonin, but I don't typically add those things for a first IVF cycle where somebody has a good AMH and I feel like they're a prognosis person, because I feel like there's so many things you have to do anyway.
Yes.
And I feel like overwhelming people with too many things to do can sometimes, be a negative.
Yes, exactly. Yeah,
So
too much, it's too much. And then it almost makes you hyper-focused too on the outcome rather than, kind of healthy living, permanent lifestyle improvements, things that you can stick to during the pregnancy too.
Exactly.
And
exactly.
we also love acupuncture. Oh, look at that. We're right on the same wavelength. We literally said it at the same time.
I think acupuncture is a great thing to think about, but again, it's another expense usually, and another thing to do on your to-do list. A lot of people really enjoy it and get a tremendous amount of stress reduction.
But you got to get in the car and you got to go do it. So if that all feels overwhelming, meditation, I can't speak highly enough about meditation.
You have to listen to your gut and it has to fit into your lifestyle.
Yeah.
And taking on an IVF cycle is already like having a second job.
Yes, exactly.
So I don't want to give people like another job,
Yeah, exactly.
So there has to be a balance.
Yeah, without a doubt. Hopefully that was helpful. But yes, I love to meditate and I love meditation, and we have a great fertility meditation app on the FertilityAnswers website, but also there's just so many great freebies out there. I pay an annual subscription to Unplug because I love how many canned meditations they have that are video based. This one woman, her voice was so nice for this sleep app. I couldn't actually fall asleep to her. It was so engaging, the quality of her voice. And so I have to go with, I have this tried and true man that like makes me fall asleep immediately when I hear his his meditation. But I'll play him for our team on Monday mornings a lot. We'll do like a 5-minute productivity one, or, a stress reducer, and you can pick like how, long of one that you want. So it's really great.
Is, can you try it for free and then there's a subscription?
Yeah, try it for free and then there's a subscription. I do the subscription because I get bored and I like variety.
My favorite is Headspace. I've been like,
and you've been doing your 3-minute one, right? Because I forgot to check in with you. You've been doing it.
I'm like now I'm like 30 days in a row.
Yes, that's amazing. Oh, that's great. Yes, I have my meditation cushion right next to my desk chair, and it's just a go-to tool. You start to feel stressed or anxious, and it's like, you can just pop into meditation for 3-5 minutes, and that's enough. It's wonderful. Frenchie Jen is bringing us back to the letrozole versus Clomid question about PCOS. And since people hop in and out of our lives all the time, I think we should revisit it. So when it comes to what's better for PCOS, I think that's sort of the key question is the what's better.
I think a lot of people are just saying, let's start out with letrozole given the recent data with PCOS. But if it doesn't work, you have Clomid as an alternative. And remember that adding things like Ovasitol and metformin can kind of optimize somebody who's resistant to letrozole or Clomid. So those are other tools in addition to, of course, eating a lot of vegetables, getting exercise, and really trying to get a good quality sleep.
I will be posting soon my video or a video, and so maybe a story. I don't know how we're doing it, but of my 7 to 10 vegetable breakfast. I
Oh,
do
yeah.
eat it with eggs because I love eggs, and the people
I love eggs too.
people that I'm working with did not say that I had to give up my eggs, thankfully, on my IVF prep nutrition plan. And so that was a big relief for me because I love egg yolks. Like it's my favorite thing. But I also, it has made a big difference to saute 7 to 10 different vegetables, depending on the week and what I'm in the mood for every morning with my eggs. So it's a giant breakfast compared to what I'm used to. No carbs, with it, and just my peppermint water. But I have a lot more sustained energy, no real mood fluctuations doing this plan. And I'll start posting like my favorite recipes and things like that for everybody.
Oh my
And oh my
God.
gosh. And I also add really yummy salsa from Costco. They have the best
Wow.
salsa. I don't know what, I mean, it is just this yummy salsa and then like a dollop of avocado too.
Oh my God. That
I
sounds
know.
delicious.
I
Yeah.
know. I got to make it for you. All right. So Venive, she had 3 pregnancy losses before her rainbow baby. She recently had another loss after having that baby. So
Wow.
yeah, so she wants to know, is there anything that can help to have another baby? Gosh, what a journey, first of all. And what a miracle with so
Yeah.
many losses that she had a rainbow baby. So,
Yeah.
I
So
mean, when you see
I
something
guess
like that, what would you
usually we
do?
try to do the same thing we did for the first baby, but of course, for your second baby, you're always older for the second baby than you are for the first baby. And then, we start thinking about genetics, like thinking about using IVF and pre-implantation genetic testing to try to reduce the age factor, to
Right.
try to say, like, let's get rid of embryos with
Mhm.
abnormal numbers of chromosomes. Let's eliminate that from the picture because that can dramatically lower the risk for miscarriage. So that might be something to think about at this point.
What are the most common chromosomal causes of pregnancy loss? Like which trisomies, are like either super high risk or guaranteed to result in a loss?
So trisomies in general are the number one cause for miscarriage, and then sex chromosome abnormalities, like an extra missing sex chromosome,
Mm,
also super common. Trisomy 16 is probably the number one out of all the trisomies. Um, of course, trisomy 21 can result in a live birth, like that can result in a child with Down syndrome. So that will not always miscarry. So some trisomies don't necessarily miscarry.
right.
I think that's trisomy 21 is the most common one. Triple X is actually something where that also has an increased risk for miscarriage, but also can result in a live birth and might not really have that much in the way of symptoms. So most trisomies will end in the first trimester.
Yeah. Okay.
Not all of them.
If you're under the age of 35 and you happen to be producing a lot of like out of those 4 miscarriages that she had, if all of them were, trisomy losses, as a for instance, maybe they were all trisomy 16 or trisomy 13, do we know if there's some kind of, is that like genetic in her? Do we know if there's some?
Thing you would think about would be, is there a balanced translocation in
Okay,
the mom or the dad?
I see.
And that's why karyotyping is helpful, to see if that's
Right.
something, because in people with balanced translocations, the risk for having a trisomy is like over 95%.
Wow.
And doing genetic testing, like doing something like PGT, can dramatically lower
Sure.
that.
Well, to pick an embryo that doesn't have that, of course, that makes perfect sense. Wow, that's amazing. I didn't realize that the risk with the balanced translocation was that high. I'm learning so much today. Okay, we have a hard stop in 18 minutes because Serena has to get on to something. Heather is asking, they knew she had PCOS, but her only option to get pregnant was to go to a fertility doctor in her case, and they recommended they do medicated treatments. So I wonder which medicated treatments, Heather, are they recommending you start with a Clomid cycle IUI, or are they recommending you go straight to IVF? But our heart goes out to you. We know the long road. If you're not part of PCOS Challenge, please consider becoming a member. If you're not part of the Fertility Answers app community, join us for that. We've been doing a lot of advocacy, both Serena and I, for those with PCOS. We've got some research
like such a wonderful
out.
community, right? There's so many wonderful people there, and they're just willing to like share their journey with you and just help you, so you don't have to struggle as much as they did. It's amazing.
Exactly. It is amazing. That's kind of the beautiful thing about our community in general. Once you're in it, we don't tend to leave, even once we've gone on to have children and be successful. I feel like we want to stay in it first.
And just helps out. It's like
exactly. It's amazing. Yeah. Nikki's asking, can you still have endometriosis and not have the period pain?
Yes, absolutely. So many people, like when we look at unexplained infertility, we actually think about 50% of people with quote unquote unexplained infertility actually have stage 1 or stage 2 endometriosis, which you cannot see unless you put a telescope into the abdomen. And we don't do that anymore. Like in the old days, when we didn't have good alternatives, we used to do a laparoscopy on every single person as part of a routine fertility workup. So
I didn't even realize that used to be routine.
That used to be what we do, because we didn't really have alternatives. And we know that laparoscopy and buzzing of the endometriosis implants in stage 1 or 2 endometriosis will raise the per cycle pregnancy rate from 1% to maybe 2%. There's a huge randomized study that was done in Canada many years ago, and it does statistically significantly double the pregnancy rate, but 2% is so low when we could get like 10-15% with Clomid IUI and 50 to 60% with IVF per cycle. So that's why we have much better treatments these days. So we no longer need to do laparoscopy,
right?
Because our treatments are so much more effective and so much less invasive and less risky. So there's this huge group of people with unexplained infertility that in the past would have would have had an endometriosis diagnosis without any symptoms at all other than just infertility.
Right. Which is incredible, especially when you hear these full-bodied, stories about people with endometriosis who faint and are nauseous and have mental health side effects and so many, and food sensitivities and things that, like, if you're not, in a way, infertility is a bit of a blessing to get the diagnosis. Because those patients often, it takes them years and years and years going through the channels of, kind of Western medicine without getting a proper diagnosis.
Scratching your head and what do you have?
Exactly. Which leads me to the next question with Pink Flamingo, which I don't know. Anytime I do see pain, now I'm sort of high alert of like, could it be endo? So she has pain during ovulation. What happens is in her lower abdomen while she's exercising, it starts with a little bit of pain, but then builds up in waves and it can be quite intense. She can even feel faint. She has bowel pressure and even nauseous. Did you hear the last part?
I didn't hear the last part. Yeah, I didn't miss the last part.
Yeah, so it builds up in waves, and then it makes her feel faint. She has bowel pressure and slightly nauseous. Could that be endo?
Yeah, absolutely. That sounds like, I think the first 5 things I think of would be endometriosis. Acupuncture might be helpful, because of course we don't want to take pain medicine while we're trying to conceive. Right. So I do think acupuncture might be helpful. That would be like the first thing I would kind of think of.
In particular, if she doesn't want to do a laparoscopy surgery to check, but if it's that debilitating, that's sort of when we see people headed for surgery.
The issue with laparoscopy is that you can get a diagnosis, but it doesn't necessarily alleviate the pain. So, if her pelvic sonogram is completely normal, not sure there's a strong, compelling reason to do a laparoscopy, but there's plenty of data to show that kind of addressing the symptom and addressing the infertility could be helpful.
And what I learned on Friday and hearing these stories of other women who have gone through this is it's so highly personal what people's triggers are. And the way that they have to kind of eat almost cyclically, for when they start to see inflammation increase hormonally. So if her trigger time is around ovulation, really keeping a food journal is what I heard on the Friday call at during the Endo Black Our Table conference. Yeah. Because I was learning like everybody has a totally different trigger. And so what one person can eat could be devastating for someone else. And that it seemed to be all tied into like the hormonal fluctuations with food sensitivities.
This is why we need more people to be aware of endometriosis, and we definitely need more research, because there's so many things we don't understand.
We need a biomarker diagnostic. That's what I think we need. And all right, Steph-Leon is asking, her doctor wants to remove her right tube because she says that her right tube increases her risk of miscarriage, and she needs to do that before their IVF or IUI. For me,
like hydrosalpinx.
Oh, okay. What is that?
Where it's a fluid-filled tube. So hydro water salpinx's tube, and that does seem to dramatically improve the chance for implantation with IVF.
See. Is it because the fluid can like pull out the embryo?
Not so much as just it impacts the development of the lining of the uterus. You can see a very lining in that setting.
Oh, that makes total sense.
Yeah, you see a lot less inflammation in the lining, a much more synchronous development.
Right.
It really, it's kind of like just, inflammatory and kind of poisonous. It's not a good environment.
Okay, that makes sense. So Steph-Leon, I hope that made sense to you, because she was saying, well, it seemed like it would make sense if they're going the IUI route, but in your mind, you're thinking IVF, they're going right into my uterus to transfer it. They're bypassing the tube. But the way that Serena just described it about how that fluid buildup is impacting the lining of your uterus, you don't want to spend all that money without eliminating something that could, make your chance.
They actually have studies, Alice, where they've taken biopsies of the uterus before with a hydrosalpinx in place and then after removal, and you can see completely different genetic profiling of the lining of the uterus. It really makes a big difference.
Wow, amazing. Okay. Kelsey said she was still here. Thanks, Kelsey. Good. Steph-Leon, planning to go to Barbados for donor IVF. And yes, she was confused about why it would be necessary before IVF. But she said that both her right ovary and tubes have fluid. Is it the same condition that you just said? And spell it for me, Serena, so we get the condition right. Hydro's easy.
Yeah, hydrosalpinx, HYDRO, and then salpinx is SALPINGX. Is that right?
Salpinx.
Salpinx, PINX.
Okay, perfect. Salpinx. Okay, great. Hydrosalpinx. Thank you for spelling that for us in case we want to look it up even further. But Steph-Leon, that makes a ton of sense, right? And now if the fluid is also in one of her ovaries, is it the same condition, or does that condition only apply to the tube?
Fluid in the ovary sounds like a cyst, so that's obviously sometimes that can be normal, it depends.
Right. Okay. But it does sound like, Steph-Leon, that Serena's agreeing that that's the best next step before you head to Barbados. And I'm glad to hear you're going to Barbados because we love them so much. I talked last time when I was talking to Anna at Barbados IVF on our live. I said, gosh, I wish I could afford to book a FertilityAnswers airplane, Serena, and just round up everybody around the country. I could take like a whole crew of people to get their transfers done.
And save me a seat.
Right? I will. Yes, exactly. All right. Let's see if there's one or two last questions before we have to let Serena go. Let's see. April is still worried, I think, about the vaccine. I know, April, you got to do what's right for you. I wasn't worried at all. I can't even tell you how relieved I felt getting the first vaccine. Everybody just know that the first one that I got, I just felt like immediate hope, even though it took a couple
Um,
weeks until after to be like 65% protected. And I'm not living any differently, but my fear level plummeted. I'm a
yeah,
single mama, and the idea that the vaccine is 100% preventive of hospitalizations and death if you
yeah,
get COVID, that's the thing that's been making me afraid this entire time, is not necessarily even getting COVID because I felt like I was young and healthy and strong. And I just didn't want to be the person who was going to be on a vent for 3 months and then have to come back from that. I was
right.
so much more terrified of having even one night away from my child and having that cause him trauma at the
Yeah.
age of 7. And I don't have family around where we live. And so it's like I was going through all my scenario planning on who do I call if I get sick enough, and like who's the emergency and who's got to fly in to take care of him and who's he going to trust? How's he going to poop alone? These are really important questions. And
Yeah.
so for me, April, that's how I made my decision, was like, plus I have all these healthcare provider partners, right? All these friends that are in healthcare that had already had the vaccine quite successfully. And so getting that first one, man, my fear plummeted. I can't wait for Wednesday where I get my
Well,
second
you
shot.
talked very clearly, Alice, in very practical terms about this whole risk benefit ratio thing.
Yeah.
Like maybe it makes you nervous to get the vaccine, but getting really sick from COVID, that's really something to be nervous about. So it's not a perfect world where things are, but we're looking at risk benefit.
And we've had 100 million people, more than 100 million at this point, take it successfully. We're seeing 2.5 million people per day in the US take it successfully.
Yeah, and we must be like up to 40-50,000 with the pregnant ladies.
Exactly,
And that
which is
data
amazing.
very
Yeah,
good. So
which is
far.
amazing.
Yeah.
If I get this, there's a big awareness campaign that I'm working on, everybody, that I hope I get the sponsor that I want for it. And I want to help drive people to do the Aspire study so that they log getting it and be part of that whole
Absolutely.
study, which would be great.
Awesome.
Yeah. Okay, let me just check these to see if there's anything. Oh my goodness, we have so many more questions. Okay, so great. Stephanie said, thanks guys, that makes perfect sense. So great. Yes, Nurse Cat, totally safe for pregnant ladies. And COVID is not safe for pregnant ladies. And so we've just really been advocating that. We've had 40 or 50,000 people who got it while pregnant. So that's a lot of
from
pregnant
the
people.
CDC V-Safe data, and Dr. Fauci, and the CDC have looked at that data, and there's no red flag so far. Really,
Yep.
it does not look like it has any impact on pregnancy outcomes so far. We will, of course, be doing updates as we get them.
Yes. It's really interesting how many people that we've had on today that have letrozole, 3 letrozole IUI cycles that are switching to Clomid. Very
Yeah.
curious. This is sort of like a fad. That
Like-
study came out and like now.
We're having like a vibe,
Uh-huh.
Clomid vibe. Well,
Right.
good luck to all our Clomid ladies.
Yes,
So,
exactly.
and our letrozole. Yeah.
Yes. All right. We have a unique question here about chances of conceiving after having a lap surgery to remove endo and only one fallopian tube. How many IUIs under that sort of scenario would you try before going to IVF, since she only has one tube?
I would prefer to go straight to IVF, because I do think even though you have one tube and it looks normal, your risk for ectopic, I would say, is still much higher than average. So the average rate is 2%. I would say you're probably in the 15% range for having an ectopic, and the IUI pregnancy rate with only one tube and endometriosis that required surgery is probably not 15%. It's probably more like 5%. So higher risks, less efficacy. I would think about going straight to IVF. Having said that, I would not do any more than 3 cycles of IUI.
Right. Great answer. Nikki's asking, how much is IUI and IVF? And of course, this is highly variable across the country and highly variable with our traveling for IVF partners like Barbados IVF. So how do you want to address that topic, Serena?
Well, usually I would say, like in New Jersey, which tends to be very pricey if you're paying everything out of pocket, you know, an IUI cycle can cost like a few $1,000s, and an IVF can cost, you know, like $10,000-$20,000 if you're paying for absolutely everything out of pocket. Now in New Jersey, a lot of people do have fairly significant coverage. And even if you don't have infertility coverage, if you have commercial insurance, usually we can get things like the monitoring covered, which takes off, you know, a few $1,000s. So
Yep.
it is extremely variable. And I'm sure, Alice, you have a lot of partners that like are doing are probably less expensive than, you know, what we're seeing in New Jersey, because New Jersey is pretty
to be
pricey.
really high. Yeah, we do. And we have partners all over the country. If you're willing to travel for IVF, we can get you, you know, 70% off within the United States and 70% off at Barbados IVF. The value of our partner Barbados IVF is that the same medications you get in the US are they're getting them from a European online pharmacy that all the Europeans use, because it's Barbados. Barbados, they're legally allowed to do that. It's the same manufacturers, it's the same medications. It's just at a fraction of the cost of the price in the US. So just connect with me if you want me to let you know the prices in your area. You know, we have a huge spreadsheet of data on all of the clinics that we refer to, and a lot of them includes pricing. And if you need access to financing, this help too.
I like to tell people that although IVF tends to be 2 to 4 times as expensive as IUI, it's like 5 to 10 times more effective.
Yes.
So IVF is actually more cost effective. The cost per baby is much, much less.
Right. So you have to keep that in mind. Yeah. That's why we don't like seeing people do endless IUIs, you know, because of the success rates and the buildup of the funds over time. So it's better to just finance IVF, go into it, assuming you might have to do more than one round. Make sure that you line up the money and the emotional bank account in advance.
Yes.
Yeah.
Definitely the emotional bank account. So important.
And we can help with that. Last question. And then if your question wasn't answered, just remember every Monday, except for last Monday, because we were fitting in Dr. Spitz in our IVF Monday talks. Every Monday though is IVF Doctor Ask Us Anything. Serena's every other week. So what is the target level of thyroid hormone that you want before someone is trying to get pregnant if they do have hypothyroidism?
Your TSH, thyroid stimulating hormone, to be between 0.5 and 2.5. Even though 2.5 to 4 is still normal, we want you to be super normal. That seems to be more optimal.
Awesome. Thank you so much. All right, everybody, if your questions weren't answered, please come back to ask us again. We only have 2 lives this week because I'm getting my vaccine on Wednesday, and we'll be back probably with 4 next week, I think, and we'll see Serena in a couple weeks. Thank you for everything, Serena. You're always the best. We love you. Bye, everybody.
Great to see you.
Great to see you.